So what is lateral thrust? Lateral thrust in a transtibial prosthesis is an abnormal outward or lateral movement of the knee during the stance phase of gait. When weight is placed on the prosthetic limb, the knee appears to thrust outward away from the body, rather than staying aligned over the foot.
The first one is lateral thrust. The causes of this gait deviation is divided by two: prosthetic causes and amputee causes. The first one, the prosthetic causes, there are two causes that cause this gait deviation. The first one is socket placement is too much on laterally, and then the second one is the socket is on excessive abduction position. And then the second one, the amputee causes, it is caused by the knee instability or ligament laxity. And which observational plane that we can observe from? So we can observe this from coronal plane. And then which phases of gait that we can observe? We can observe the gait deviation on the stance phase. And then for the GRF, it is passes medial the knee and creates tendency of socket rotation to laterally, or it is made varus movement of the knee.
We got two problems. The first problem is if socket placement too much lateral, the correction strategy will shift the socket medially. And then for the second problem, which is excessive abduction of the socket, the correction strategy is adduct the socket and shift the socket medially.
Name of Gait Deviation, too much flexion. Definition: too much flexion of the socket intertibial prosthesis is an excessive forward tilt of the prosthesis socket relative to the pilon or foot component. This means the socket is angled too far forward, causing the knee to be excessive flexed during standing or walking. And the causes is prosthesis causes. The first, socket is too much flexion. 2. Plantar flexion bumper too stiff. 3. Heel flexion too hard. 4. Socket is set too much anterior. 5. Dorsiflexion bumper too soft. 6. Prosthesis foot too small. 7. Suspension feature prevent the knee from full extension. Amputee causes. And the last, knee flexion contractor. And the next observed plane in the sagittal plane, and the pace of gait is 10 pace, and the GRF will pass more posteriorly of knee joint axis. And the correct strategy is the first problem: if socket is too much or excessive flexion, and the correct strategy is extend socket and shift the socket anterior. And 2 problem, if socket is set too much anterior, correct strategy is shift the socket posteriorly. And pain at anterior distal tibia and posterior proximal of the stump throughout stand pace because too much pressure in the area.